Good morning, everybody, and welcome to Policy and Practices joint webinar with the Bevan Foundation today on Wednesday, the 7th of June. We're delighted to have you join us today. Thank you very much for doing so. Before we get into the exciting content that we've got to share with you today, I would just like to do a little bit of housekeeping with you, if I may, by way of an audio check. If I could ask you to raise your digital hand in the panel on the right hand side. Thank you. You should be able to see that. That's brilliant. So I know you can hear me okay. In that same panel, you should be able to see either the chat functionality or the place where you can ask questions. So please, I do encourage you to ask questions throughout the whole webinar, and we'll have plenty of time at the end to go through them. In the true webinar fashion, we will have one poll to keep us nice and engaged, and also there is a download in that panel as well. Do take a look at that. At the end, when the webinar finishes, we'll have a very short 3-question survey, and we'd really love your feedback. So appreciate that in advance. We will have you on your way by 11:45 this morning. And as always with policy and practice webinars, the slides and the recording will automatically follow, so no need to take copious notes as we go along. If you're on Twitter and you would like to follow us, we are at policy_practice, and also do follow the Bevan Foundation at Bevan Foundation as well. Brilliant, thank you. So I think that's all of the housekeeping done. And just before I introduce our speakers, for those of you who might not know policy and practice, I know my colleagues will tell you a little bit more about the work that we do shortly, but just to introduce us as an organisation. So we're a team of policy professionals with extensive knowledge of the welfare system throughout the UK, and we're very passionate. Jointly with the Bevan Foundation, we're very passionate about making social policy work, and this is what we're going to talk about today. You may have seen us give evidence to parliamentary committees and so on, and we're very excited to bring some of the work that we've done today, our policy work, to you. We also, though, work with many, actually more than 100 local authorities throughout the UK who use their data to identify vulnerable households, target support and track those interventions. And also, you might know us from our benefits calculator. We're one of the 3 free benefits calculators available on gov.uk. So you might have heard of us in that way. But nevertheless, like I say, I would like to now introduce you to our speakers who are going to turn cameras on, and we will be able to get into the main content for the day. Brilliant. So my name is Janet Harkin. I look after the marketing function at Policy and Practice, and I'd like to introduce my colleague Jack Rowlands. Jack. Good morning, Jack.
Morning, everyone.
Morning, brilliant. And I'd like to introduce Dr. Steffan Evans from the Bevan Foundation. Morning, Steffan.
Hello, good morning. Hiya.
Morning. And also my colleague Zoe Charlesworth from Policy and Practice. Morning, Zoe.
Morning, Janet.
Brilliant, great stuff, and more from our speakers in due course. But without further ado, oh no, I'm going to talk to you about the agenda. Do apologise. So what we're going to be talking about in today's webinar, we're going to be, Steffan's going to talk to us about the context for the work, introducing the Bevan Foundation and the funders, looking at the context and the background to poverty in Wales, and also why this really important work was undertaken and commissioned by the Bevan Foundation. Then we're going to look, I think it's Zoe that's then going to talk to us about the project and the advantages of a common approach to Welsh benefits and what this might look like. And then the analysis that we did, so the benefits that we looked at and the data behind that as well. And then Jack will talk us through the findings and the recommendations, and we'll have a look at the costings and the potential impact as well. And then Steffan's going to take us through the next steps. And as I say, plenty of time for Q&A. So I think now, without further ado, I'm going to share these for you. Excuse me. I'm going to share these links in the chat now to the different reports that have been published, already published in May. And Steffan, do you just want to say a couple of words about those 2 different reports there on the screen that you can see?
Yeah, so the first report I guess you've got on the top there is, I guess, a copy of the report that Policy and Practice have published for us. And there's also kind of the exact summary has been translated into Welsh as well. And then the second report there is by the Senedd, the Welsh Parliament's Equality and Social Justice Committee. They've been undertaking some work into the impact of the cost of living crisis on debt, and they've drawn and made significant recommendations already drawing on the work of that first report. So that might be of interest to people as well, to get a sense of maybe where the politics around some of this has already kind of developed.
Brilliant, thank you. Thanks for that. You do a far better explanation than I will. But I'm going to, just for everybody on the call, I'm going to just put those links that are on this slide. I'll put them in the chat as well. But while I now hand over to Steffan, and over to you. Thanks, Steffan.
Yeah, lovely. Well, thank you very much, Bwrdd pawb, and thank you for the welcome here today. So go on to the next slide. I'm going to be talking a little bit about the context to the work on Welsh benefits. Talk a little bit about kind of what do we mean when we're talking about Welsh benefits, and also then maybe setting the scene as to why we've commissioned Policy and Practice to do work for us in this space. Just by way of background about the Bevan Foundation, for those of you who are not familiar with us, we are Wales's most influential think tank, and we very much focus on trying to gain insights into issues in Wales, develop solutions, and then work for change. And our work on Welsh benefits has very much followed this pattern. And if you want to find out a bit more about this, make sure you visit our website, and you can find out how you can support our work as well. So in terms of what I'm going to be talking about for the next sort of 10 minutes or so, first I'm just going to give a little bit of the background about actually, when we're talking about Welsh benefits, what do we mean? Then I'll move on to talk about why we think there is a case for reform in the current system, and then setting out kind of the purpose of the work that Policy and Practice have undertaken on our behalf. Just go on to the next slide. So yeah, what are Welsh benefits? So just go to the next slide. Social security system in Wales, I guess, is very different to kind of, I guess, most other parts of the UK. So the powers over social security per se have not been devolved to Wales. That's obviously different to Scotland, where some administrative powers over the benefits have been devolved, and the powers to create some new benefits, and to the position in Northern Ireland, which is very, very different again. So, and it's important to note that, you know, those powers, be that those administrative powers or just powers over benefits more generally, have not been devolved to Wales, kind of in any shape or form. At least if you look on the face of the legislation that kind of sets out the devolved powers of the Senedd. But, and if we go on to the next slide, actually, when you dig a little deeper, the distinction between what the powers that has been devolved to Wales and hasn't becomes a lot murkier. So the Bevan Foundation has been working on the idea of Welsh benefits for a number of years now. And what we mean by Welsh benefits are the kind of the grants and allowances or in-kind provision that's provided to people on low income where eligibility is restricted. So these are means-tested forms of support that provide support to people on low income. And in 2018-2019, we calculated that more than 400 million was spent on these different kind of support schemes at that point in time. To put that in context, that is more than was being spent on job seekers allowance or the work element of universal credit combined. And to give you kind of an example of what we're talking about here by grants and allowances, mean-tested grants and allowances. So we've got things like the council tax reduction scheme, which provides people with support with the cost of the council tax, free school meals, discretionary assistance fund, so that's a crisis support, kind of discretionary crisis support, the education maintenance allowance, and something like discretionary housing payment, where yes, powers of there are powers there at Westminster, but there is an ability for the Welsh Government to top up payments, for local authorities to top up payments, and it is local authorities that are responsible for administering those schemes as well. So there's a significant swathe of powers that are essentially benefits, but maybe haven't historically been viewed as such, because benefits per se haven't been devolved, and these have been viewed separately from each other. So if we go on to the next slide, we think that these really matter because they top up the support families receive through the UK social security system. They put more money into the pocket of families that are struggling and can, in some cases, lift people out of poverty. And there's also, we think, significant scope to improve the support on offer through these schemes. So, looking at the case for reform, so we know these are important, and we know that they can make a difference to people, and there's a lot of money spent on them. But so why do we think there's a need for reform? Go on to the next slide. At the moment, there are quite significant limitations to the way that we administer and the way that we operate Welsh Benefits. And through our work, kind of through 2018-19 into 2020, we found kind of 4 key issues we felt that there was with the current system. So the first is that access and support is really difficult for a lot of people. Because these different grants and allowances aren't viewed as part of a cohesive system, people end up having to make multiple application forms, submit multiple applications for related means of support. So, you know, it's perfectly possible that a household might have to submit 4 or 5 different application forms to get all the support schemes that they're entitled to. You know, if you have I could have did some work earlier this year, but could have worked out that if you had a child in preschool and primary school, there'd possibly be as many as 6 different application forms you'd have to fill in for rights-based criteria. And if your circumstances were such that you were entitled to extra discretionary support on top, there might be another 2 or 3 forms you need to fill in to get those supports, that support as well. So it's difficult to access because it's kind of not viewed as part of a cohesive whole. There's also issues around the eligibility criteria. They differ between schemes. Also, there's questions about, are the criteria, is the eligibility for income threshold set in appropriate places? So free school meals is an obvious example of this. So still in secondary schools, if you're on universal credit and your income is less than £7,400 a year, you're not eligible for universal credit. There's questions around the value of support, about, you know, is some of these cash-based supports, so like EMA, for example, is that providing people with enough support to make a difference? And there are also questions about whether there are gaps in provision. You know, are there some kind of areas where people are struggling with, but where there isn't support available for people? So there are significant problems with the current system, despite the valuable support that they provide. And we think establishing a Welsh benefit system could make a real difference to these challenges. Viewing the system as a cohesive whole and bringing the system together, we think could make it easier for people to apply for all the Welsh benefits that they're entitled to. It could also make it easier for public bodies to administer Welsh benefits if they were kind of viewed as matching up to each other and kind of try to be taken together as a more kind of cohesive kind of approach. It could boost take-up, because we know that if you improve access to benefits, that in turn increases take-up. And we think it provides an opportunity for a more holistic discussion about the support that is available for people on low incomes. So thinking about the response to the cost of living crisis, for example, we've seen a lot of additional one-off payments put in place. If we viewed Welsh benefits as a whole at that point in time, could there be an opportunity to provide some of those extra funds into schemes that already existed to get the money out the door easier for people? So if you go on to the next slide. So with that in mind, why did we decide to work with policy in practice? Well, at the moment, there is cross-party support in the Senate for establishing a Welsh benefit system. We've seen kind of various votes, various debates, and there are people from all the parties who are actively talking in favour of Welsh benefits. We've also seen Senate committee reports. I've already mentioned one, but there are other reports going back over time where a lot of people are saying, this sounds a really good idea, why don't we do something about it? We also know that there are examples of best practice within local authorities in Wales who are already doing some of the sort of things that we'd like to see done more widely. So people using data cleverly and effectively to boost take-up, to get more people getting the support they need. And we know that the Welsh Government supports the idea and principle of creating a Welsh benefit system. You know, we know that this is something that ministers and officials are supportive of. And there has been work going on at Welsh Government level of developing a Welsh Benefits Charter, which is kind of set out, I guess, the principles that would be underpinning a Welsh benefit system. But we want to turn that kind of broad support into practical action. And whilst having a charter is a great step, we want kind of a system to be more than just a set of principles and actually be kind of real practical changes on the ground to make life easier for people in Wales. And to achieve that, we felt that there was a need to better understand the barriers to implementing a Welsh benefit system and a need to develop solutions to be able to put such a system in place. And to achieve that, we've worked together with a coalition of 9 other organisations, 10 organisations in total, to fund policy and practice as external experts to explore the feasibility of establishing a Welsh benefit system from a data perspective. And we focused here on the data because that's something that we've heard over and over again is a major barrier potentially to establishing a Welsh benefit system. So we were keen to explore whether that was the case and what were the actions that you might need to take to make that a reality. As you can see, kind of from the logos on the screen, there's a real diverse range of organisations that have been involved in supporting this work, from Welsh Local Government Association to trade unions to charities that provide support directly to families. And through this work, our focus has very much been on the rights-based benefits. Discretionary forms of support provide really important support for people, and we think there's a road to continue those. But when we're talking about trying to make a cohesive system, maybe with one access point to Welsh benefits, that's obviously going to be much easier with rights-based benefits than discretionary benefits where there are differences potentially. So that's why the focus of the work that policy and practice have undertaken for us has very much been on those rights-based benefits.
Brilliant. Thanks very much, Steffan. Really interesting, great scene setting. I know we're going to come back to you at the end to round everything up. And just as a way to hand over to our next speaker, Zoe, I'm going to just serve a poll because, as Steffan says, data very much is at the forefront of one of the barriers that we were looking at. So what we're interested to hear about, a quick poll up on your screen there, does your organisation use data to identify eligibility to extra benefits? And the answers that we have given are that we would like you to select one of. Yes, we use our data to identify eligibility to extra benefits, and that's part of our standard way of operating, part of our standard business. Secondly, you do it occasionally, perhaps as part of a particular campaign. Third, you've never done it, and fourth, you're not sure. So great, I can see many of the answers coming in. Thank you very much. Looking quite even Stevens at the moment, so do cast your vote, and then once I finish that poll, I'll put the results up on screen and ask Zoe to comment. Brilliant. Okay, I think I'm going to close the poll right now and then share the results on the screen for you. And hopefully you should see them there. Zoe, would you like to comment on those poll answers?
Yeah, absolutely. Thanks, Janet. And I think this is more or less what we would expect. I know there's a lot of local authorities on this webinar, and using data to its best effect as part of standard business is, I think, partially what the Welsh Government is after, in that data is merged between organisations. It's used best to support their residents. We know a lot of local authorities are using data occasionally as part of a campaign. And I think it's really moving on from that. It's moving to it being a standard part of business, standard part of data sharing, practically seamless. And I think that's partially, that certainly touches on some of the results we found in this bit of research.
Brilliant.
And it's really good to see 35% already doing that. So that's just great.
Fantastic. Let me hide those results now, and Zoe, hand over to you to take us through our work. Thanks, Zoe.
Thanks very much, Janet. So yeah, and Steffan for that introduction to this piece of work. So as Steffan mentioned, this piece of research was commissioned to look at how data can help form a more cohesive Welsh benefit systems and the barriers within data, using data to form a more cohesive benefit system. We weren't looking at the value of current awards, and we weren't evaluating gaps in provision. That's a separate piece of work for the Welsh Government. What we were looking at is where we are now, how you could actually move to having a more seamless and a more cohesive benefit system. And we were looking specifically at the Welsh rights-based benefits. I've got them here: council tax reduction, free school meals, healthy start vouchers, help with health costs, education maintenance allowance. I don't know if people from English authorities can remember that one. The Welsh Government Learning Grant, which is to support people, adults, to return to education from low-income households, and the Pupil Development Grant, which is often called the Access Grant. And these are the ones we were looking at. We were focusing on the rights-based benefits and the how these work now and how they could be merged into a more seamless system. Thanks, Janet. Steffan really covered this off. Why is a common approach important? And my colleague Jack will be talking shortly about the value of awards, but really if a household was getting all the Welsh benefits, it's an additional over £5,000 a year. So this is really important, that to move towards people being able to access these better. There is also the idea of Welsh benefits having a distinct identity, forming the basis of our holistic Welsh system with visibility over Welsh residents, so support can be targeted at those most in need. And I think the overall objective is to maximise household finances for Welsh citizens. So although we're talking about data, which is a bit dry, a bit boring, the aim of this discussion on data is to get to a really practical application for Welsh citizens. Thanks, Janet. So we started by looking at the current situation. The current application process lacks cohesion. We've got different organisations administering different benefits, all with their own different channels of delivery, web applications or paper applications. There's a mixture of paper-based, online. They don't even look the same, the application form. There is not a feeling of cohesion like these are all part of a Welsh benefit system. There is limited use of data to identify eligibility to additional benefits. Now, within some of the councils, this is really advanced in that a number of councils in Wales are using as much data as they can get hold of to identify who needs further support and which benefits they should apply for. But this isn't across all organisations. If we consider that we've got administrative organisations from the health service, central government, local government, and between those, the approach is different, but also between councils, the approach is different. There's between these different organisations, there's not much data share at the moment. And there's very little use of the data that one organisation collects to ease application or verify circumstances for another organisation. Thanks, Janet. But Wales is in a really good situation in Wales, and with all of these organisations, there's a really good, we're in a really good position to make changes. And it's the right time to do it. And this digital nature of data capture ensures that there is a lot of data held there, maybe amongst different organisations, but a lot of information on, so sort of a sort of shared out visibility of the residents. There is also the universal credit data share now. Since universal credits come in, there's one central administrative organisation in the UK that is collecting a lot of data on people and sharing this with local authorities. It may be that Wales doesn't want to go down the route of basing a benefit system on that, but it can be used at the moment to assist application. All the application processes for all these different administrative organisations do use digital verification to differing degrees, but these are the information isn't shared between them. But the commonality of benefits across Wales, Wales is in the position where the Welsh Government and local authorities are working quite closely together to ensure that the postcode lotteries that we sometimes see between local authorities in England are not as evident. Wales, for example, CTR, all councils have agreed to one scheme, which is partially funded by and topped up by the Welsh Government, to ensure that there isn't a postcode lottery between councils. That commonality across Wales means they're in a very good position to move things forward. Thanks, Janet. So this is a bit of a whiz through, I'm afraid, but do have a look at the report if you're interested in looking at the findings and recommendations in more detail. I'm just going to pull out some of them now. Thanks, Janet. Let's move on to the first one. So the first thing we did with this bit of research was try to map the various data sets, databases for each benefit against each other to see how much commonality there was. We also mapped them against the universal credit data share, just to see if that could act as a basis for all benefits. There was very little overlap because most of these benefits are for very, very specific purposes. So the data is collected for that purpose, as you would expect. Obviously, details of household members, things like that, addresses, common across all of them. So there is some commonality, but not as much as allows us to use one data base as a basis for other benefits. But what we did identify is that the data held and the universal credit data share can be used for identifying eligibility for other Welsh benefits. Not for assessment necessarily, because not all the data will be there, but certainly it can be used for identifying who is likely to be eligible for further benefits. And we felt that the application process and even assessment of awards on free school meals and CTR, so two of the rights-based benefits we're looking at, is possible from current data held. Thanks, Janet. So overall we found that there's considerable scope for using the data more effectively as a move to a more uniform approach. And we're looking at, I'm going to be looking at our recommendations broken down into these three categories. So identification and targeting of support, the application process and verification. So let's move to the first one, the targeting of support. So the identification of eligibility. And this is obviously relevant to English councils in exactly the same way. But in Wales, they're looking at identification across councils being uniform. Everything we're saying about using data to identify eligibility obviously applies to all councils. What we would suggest, one of the recommendations was that all current available data, particularly the UCDS, is used to identify potential eligibility to other Welsh benefits. There's much more detail about this in the report, so do have a look. We also suggested that arrears data could feed into that process, certainly to identify potential CTR applicants. And we recommend that there's eligibility checks for further benefits at the points of application for any individual Welsh benefit. So if you apply for one benefit and you put in household details, you're automatically notified of what other benefits you may well be eligible for, rather than you have to find out through other mechanisms what other benefits exist. We also recommended that councils use some sort of tool to identify potential eligibility. For example, the LIFT tool, but there are other tools out there, using all their data, bringing all their data together so that they can identify who their residents who would be eligible for other benefits. And it would be good to see that as a common approach across Wales, rather than, again, being localised, regionalised and a postcode lottery. And one of the other recommendations around eligibility is encouraging further universal credit data share by the DWP, just so that councils can have, not just councils, the Welsh Government, administrative organisations, will come on to rights to share that data and what it could be used for later. But yeah, so we would like to encourage the use of more data sharing by DWP, because at the moment, the data that councils receive has only got the visibility of those who have an intent to claim CTR, which obviously non-householders are not included. Thanks, Janet. Looking at application for these benefits, the first one's obviously just something that sort of struck us immediately when we started this research, is the lack of cohesive design. It's not really a data point, but it's an interesting point that each application form, the design, just the look of it is completely different. Also, you have different, some of them are not online, some of them are paper-based still. So a cohesive approach to application. We suggest that the agreement to apply for all other Welsh benefits and and B, that the data is used to identify eligibility to Welsh benefits is captured at the point of application for a single benefit. So that the data sharing issues are not, data sharing barriers are overcome to some extent if that can be captured at the point of application. We also suggested that all the administrative organisations review their current data capture requirements. This is because sometimes they were asked, the application forms are asking for data that is then checked against a portal, a verification portal. And that just doesn't seem necessary to ask that. So, for example, asking somebody how much universal credit you're getting, when you actually have, you then go and check that they're getting universal credit and the amount, you know, a tick box would do. So it's going back to each of those organisations and suggesting that they do a comprehensive audit of the information they're asking for, and is it actually necessary? Having worked in a local authority for many years, I know how application forms build up over time, and sometimes you just need to step back and to go and have a look at them again, and do we actually need all this information? We also suggested that that the organisations maximise data sharing between Welsh benefits, so that this can move us towards automated data capture for subsequent benefits. It's a phased approach, but by starting maximising data sharing within the bounds of what you can do and the legal guidelines for data sharing and the frameworks, there should be greater data sharing between Welsh benefits. Thanks, Janet. We pulled out two of the benefits in particular, council tax reduction and FSM. Now, council tax reduction, obviously, that's what the UCDS is shared for. So, but that didn't mean that you had a uniform approach across Wales. So even though the UCDS is shared for CTR administrative purposes, all councils get the same data and all councils are administering the same scheme, the approach between councils is still very different. And we would suggest that actually that should be more uniform. We suggested that the Welsh Government may wish to look at their current council tax reduction scheme and align it better with the UC data, and provide guidance to councils on accepting the universal credit data share intent to claim notice as a claim. Now, in English councils, some do, some don't. In Welsh councils, the position is exactly the same. Some will accept an intent to claim as a claim, others won't. Different legal departments are making different interpretation, and maybe a central interpretation would be useful here. We also suggest that there would be a lot of use for a central interpretation of the level of risk that councils are expected to take. So the level of manual intervention required for a new claim. At what level do you say, yes, that's enough? Now, there's different approaches to risk and verification across councils, and a central guidance may make the process more uniform across councils. In the end, councils have to decide for themselves. They're the ones administering the benefit. But central guidance is always going to be useful in moving towards a common approach. Around free school meals, when we were looking at the data, households, I think I've just had a power cut. Households come into contact with local authorities over and over again when they've got children, and we were suggesting that the agreement from households to use their data for free school meals assessment could be captured at any stage, rather than asking people to capture at a moment when they might be in crisis, when they might not be you're having to engage with lots of different organisations. Thanks, Janet. Around verification and evidence, we suggested that circumstances, people are not asked to provide evidence when the data already exists. I know that sounds so obvious, but it was happening. For example, the UCDS, if somebody is getting universal credit, then they have right to public funds. So why are we asking to see passport identification or that sort of information? And there's a number of examples given in the report where residents were asked to provide information when that information was available in the data actually held by the administering organisation. We suggested there's a common verification portal used across all organisations, because some of these administrative organisations had quite in-depth verification portals with lots of different organisations, others didn't. It meant that the process for every claimant, how much information they had to supply, was differed between organisations, differed between benefits. And actually, if that was standardised, you aren't putting that barrier to application on the resident. We also suggested additional legal gateways, and some of the guidance around current legal gateways would be useful. Thanks, Janet. So that also, it's all very positive. All looked like there was things that could be done, and change that could be data could be used to move towards a more cohesive Welsh Benefits System. But we also brought out some significant barriers to change. I'm sure everybody within local authorities will know most of these barriers. There was a risk of reliance on external data. Most organisations like to have collected the data, verified it themselves. There is a reluctance to use data that has been verified or supplied by another organisation. Again, that comes down to guidance on risk. No council or any other administrative organisation wants to be liable for errors. So I think there needs to be central guidance about risk and the approach to take to rely, certainly around reliance on external data. Wariness of algorithms, I think that's always going to be there. It's always brought up, but these aren't algorithms, it's just data. The cost of increased take-up, any change has a cost, but there's also, if benefits increase, then if the number of people, if you make the system simpler, more people will apply for benefits. There is actually a cost there. My colleague Jack will be coming on to that in a minute. The data sharing protocols and permissions, again, always a big barrier. There's a lot more about this in the report if you're interested. Adherence to historical ways of working, again, a cultural issue within organisations. And there were barriers with long-term contractual arrangements with current IT companies. So any change would require some understanding of those contractual arrangements and to ensure that longer term ones are not entered into if change is coming down the line. So because of all these barriers, any change requires buy-in and commitment from all the stakeholders. Thanks, Janet. Because there are a number of barriers to overcome to move towards a more cohesive Welsh system, we suggested a phased approach where certain actions could be introduced in a relatively straightforward manner, not costing too much, with other ones on a long-term plan where further research may be needed or further development. So in the short term, we suggested that there should be a cohesive design, just so that idea of a Welsh benefit system, that these are all part of the same system, sort of settles as other changes are made. Going back to the point made earlier, review all current data capture requirements. There were a lot of data capture requirements that really they were asking the resident for information that they already held. A common approach to identifying eligibility to Welsh benefits, and also inviting applications at the point of application for any benefit. As I said, you can't use the data for one single benefit to assess another benefit. As I mentioned earlier, when we did the data mapping, we saw that they were quite different. But you can look at the characteristics of the household, the characteristics of the circumstance of the household, to have an idea, pretty good idea, of what other benefits it's worth them applying for. and we would suggest that could be introduced quite easily. For CTR specifically, we recommended that councils work with the Welsh Government to have a common approach around the intent to claim CTR and how much automation is brought into the assessment process, and that comes down to the level of risk and some guidance on that, some agreed level of risk taking across councils. Guidance from the Welsh Government would be incredibly useful just to ensure that each council is working the same. And going back to the point on free school meals, yeah, that can be captured at any point. So we recommend that's a really easy thing to start introducing. And obviously there's a longitudinal aspect there that you have to start earlier. Thanks, Janet. In the longer term, we suggest a common digital application form. Now, that might not necessarily mean a common database. There are two pathways that a common digital application form can feed into. It can feed into a common database, or it can feed into the individual databases, which are merged to form a common database for research and take-up purposes. So a lot more information about that in the report, but a common digital application that captures the information for all the benefits is your main starting point. A multi-agency portal for evidence verification, again, just to ease those barriers to application. We suggest that the Welsh Government may wish to look at their council tax reduction scheme. It's based on the old council tax benefits scheme. And there's a lot of advantages of that around tapering and around nuance, but there are areas within it that could be aligned better with universal credit, which means that you then ease the barriers to application because you could start moving towards automation. We do suggest that the Welsh Government, perhaps with the Scottish Government, because I know they're looking at this as well, works with the DWP to include an indicator of intent to apply for Welsh benefits within the universal credit application. In a similar manner to, at the moment, the intention to claim CTR. Do you intend to claim CTR on your UC application? For all households with a Welsh postcode, they could be asked whether they wish to claim Welsh benefits. That gets over a lot of the data governance barriers, and it's probably the simplest way to get over some of those barriers. And as we mentioned, continued discussions with the DWP on greater sharing of universal credit data. Thanks, Janet. And finally, just a couple of points here. I think it's really important that change can only happen if the organisations involved work together, and became so obvious when we were doing this research. All the organisations are doing great work administering the benefits for which they are responsible, but with different interpretations across each of these organisations. They need to come together. It needs a joint approach with the Welsh Government providing guidance and support where needed, and the organisations to come together to agree a common approach. In Wales, there's a will for change, as Steffan said. Most organisations, councils, Welsh Government, third-party organisations, they want change. They want a more unified benefit system. So that will should actually be the driving force to make this happen. And any common approach, any move towards a common approach, can lay the foundations and prepare for further developments of Welsh benefits. No one knows where the benefit systems are going in any of the countries, any of the regions. But eventually, it may be that Wales has further devolved powers in a similar manner to Scotland, and to actually start thinking about a common approach, a uniform Welsh benefit system at this stage lays the foundations for that happening. Thanks, Janet.
That's great and really comprehensive. Thank you so much, Zoe, and thank you to those of you who have already put your questions forward. Please continue to do so as I hand over to my colleague Jack. Thanks, Jack. Over to you.
Great, thanks, Janet. Yeah, I'll try and keep this section brief. I think as Zoe's kind of covered the main core findings, and I think as you mentioned, we've got some good questions to get to as well. But just to kind of explain how we came to our kind of findings, we did start by looking at an assessment of what the current costs and what sort of take-up we think might be likely for each of the Welsh benefits. So on the screen we've got the 6 that we modelled, and we've just broken down what the average value is for each one. So for council tax support, we found that the average value was around £1,000 for a household, and the take-up was around 65%. So this was quite low and had perhaps one of the better potential for increases. Free school meals, we worked at around £550 per year based on the unit cost of each meal. Obviously, the take-up is around 72%, but that's for secondary meals. In Wales, there's a system now of universal free school meals up to a certain age. The same in Scotland. So depending on where you are in the UK, that bigger figure can apply to the whole school cohort. Pupil development grant we worked out is for most years £125, but for some year groups there's different amounts, and Welsh Government has applied a slightly different figure on some occasions. Healthy Start is worth around £1,000, and take-up's around 78%. That was an interesting example though of one where NHS Digital provide the take-up figures, and I think have stopped publishing it as of last year. So there's a few examples here of different benefits where actually the data sometimes resides with other organisations, and it's about how you potentially connect the two. EMA is worth again around £1,000. Take-up is considered to be higher, I think, with the better sort of feasibility that it has, and in Wales it's worth a little bit more because the total payment has been increased. And the Welsh Government Learning Grant is around £1,500, and again we assumed it was around a similar rate to EMA. If you could go to the next slide, Janet. So as I mentioned, a lot of these benefits do depend on sort of what the eligibility criteria is. So we looked at the likes of council tax deduction and free school meals, which we had a better estimate for take-up. I won't go into the sort of direct cost figures. I think if you're interested in the total amount in the Welsh scenario, that's probably in the report is a good place to read that detail. But yeah, in the case of council tax deduction, we saw the biggest potential for an increase, with only 65% currently claiming. There's no reason if you increase the system, if you had an automated claim, or if you had it connected better to universal credit, you could really get take up almost to 100%. That would be one where councils have the data set already. They could tap into that. For free school meals, we estimated only around 5% increased take up, where take-up's currently higher. There's questions around at certain ages whether people have a stigma around claiming it. So yeah, there's some groups that may be more challenging to get take-up increased for. If you could go to the next slide. Again, with pupil development grant, I think we found that it was notable how many of the benefits had a passported connection. So a lot had very similar criteria to free school meals. So someone who's eligible for one is likely to then also qualify for others. So in pupil development grant, it's an educational based benefit, so had very similar profile. We modelled a very similar take-up rate. Healthy Start, I think we modelled the take-up was lower, and that there was better potential for an increase. But I think, yeah, it's probably more important to people to look at. I think for policymakers, the question is around what kind of system do you want to build to help increase the take-up for these. For people on the ground in local authorities, I think the bigger question is actually what are the take-up rates at the moment, and which of these benefits pose the best opportunity to do a targeted campaign and reach out to people to get them claiming tomorrow, rather than perhaps the 6-12 month question around how does the system change? If you could go to the next slide. And yeah, finally, sort of looking at EMA and Welsh Government learning grants again, both educational benefits. So yeah, strong overlap with free school meals in terms of the criteria that apply, and we've modelled different costs, EMA being a slightly larger scheme in terms of the total cost. And yeah, so that's kind of the estimates that we provided. I think the other thing to bear in mind is that the increases that you'll see if there's a targeted campaign or if there's a change to the system will all be very gradual. So you can't assume that you'll have a 10% increase from day one. Some of these benefits will just take longer to filter through. Depending on the benefits, some people are just easier to reach. Some benefits you may need to change forms or websites to make it easier for people to understand. So yeah, probably looking at maybe the benefits for younger people may be easier to increase if you've got schools that are more engaged. For things where it's councils having to go out to residents and ring them up or write to them, that's always a bigger barrier to getting hold of people. If you could go to the next slide. And I think the main thing to come away with the costings is that we obviously calculated a combined cost or combined benefit to households if they received all of the early age benefits. If they then went on to receive council tax reduction, there's a combined figure that is very valuable to households, and often if you're on a low income, you're likely to continue to receive these benefits throughout your life. The main thing though is that obviously there's a cost associated to the government to increase the take up, but that's not a cost that necessarily isn't ever seen again. Low income households have a need to spend the money that they receive. They've probably got smaller budgets and they are more likely to spend it in the local economy. And there's a benefit to the councils. I know there's a question I think coming up later about how to be preventative in your approach, and I think this is the opportunity to get ahead in early life or at an early stage in people's lives to tackle the causes of poverty, and you'll see the benefits later on in reduced savings in other departments in later life. Next slide. Yep, so I think covered that off about the early life benefits. And yeah, income maximisation, tackling people's debt, tackling later costs in the case of social care, looking at arrears and insecure housing. There's lots of knock-on effects that if you increase people's incomes in one part of their life, it helps them to tackle some of the other issues that they're facing. And I think that's all of my slides.
Very good, brilliant. Thank you so much, Jack. It is indeed. So at this point, and we will come back, Jack, I'm sure, to some of the points you raised during the Q&A, but let's move over now to Steffan, who's going to wrap it all up for us. Thanks, Jack. Steffan.
Yeah, I've just got 2 quick slides before we kind of give people a chance to ask any questions they have. So in terms of next steps, I think it's fair to say that the report has already been very well received. You know, we've had positive feedback from people involved in the third sector, from various stakeholders, politicians, officials. So we're hopeful that this is a report that is going to have an impact. You know, not just something that that's going to be of interest, but maybe not lead to any change. We will be meeting with relevant Welsh Government ministers over the next few weeks to discuss the report in detail, and we're hopeful to have a bit more information off the back of that in terms of what the next steps are from their perspective. And as already been discussed today, we've already seen the Senate Equality and Social Justice Committee making a call on the Welsh Government to develop a Welsh benefit system and to put some of the changes we've discussed into practice. And yeah, and finally, in terms of what we'd like to see, well, I think what we'd like to see is kind of the Welsh Government and local authorities to get on and implement some of the short-term reforms outlined by Zoe and Jack in their report and in their presentation today, and then to consider and to look to set up a working group or a task force to work towards implementing some of these more medium to longer term changes. Some of those changes will take time, but what we're keen to see is that process starts early because obviously the longer we delay that process, the higher the risk is that that process never gets going at all. So we think there's a need to really kind of, in the relatively near future, to start planning about putting some of those longer term changes into practice. And then finally, we're going to be working over the summer with many of the partners who co-funded this work and some other interested stakeholders to capture people's lived experience of a system, to remind everyone again about why this is so important, because we know from work we've done in the past that this really does have an impact, on people's day-to-day lives, their ability to afford the essentials and to have a good quality of life. So I think that kind of wraps up really what I was going to summarize really in terms of next steps. So if I hand back to you, yeah, we'll open up to questions.
Brilliant. Thank you so much, Steffan, and thank you too to Zoe and to Jack as well for the very comprehensive talk through the report. I have put the links to the report in the panel on the right hand side, so please do take the time to check out the full reports as Zoe was mentioning. So we've got lots of really interesting questions. Thank you for those of you who submitted the questions in advance. That always helps from me and my admin point of view, but also to those of you that submitted them during the webinar. So let's get cracking. First up, Steffan, to yourself. Jack did mention the prevention piece, but somebody has asked, what can we learn from the current system to ensure that a Welsh benefit system is preventative?
Yeah, so I think we know in a whole host of areas that getting money into people's pockets can make a real difference. It kind of reduces the risk of living in poverty in the near term, reduces the risk of people, kind of maybe cutting back on food, for example, which is going to put a pressure on the health service and on education, and kind of we know that has longer term effects as well. So making it as easy as possible for people to get the support that they are already entitled to. I think that's really important here as well. What we've been talking about today is enabling people to get the support that they're already actually entitled for. There may be questions in time that we might want to explore about, can you make the system more generous, for example? But at the moment, what we're talking about is making sure that everyone gets the support they're actually already entitled to. So I think kind of improving that has real kind of benefits, could potentially save some money as well for local authorities, if the system becomes less bureaucratic for them to manage as well, enabling them to free up their staff to go and do some other work as well that could be support families in the same context as well.
Great stuff, thank you. Any points to add, Zoe or Jack, on that prevention point?
Yeah, I think it's a really good question, and it's one of the things that we were looking at very much within this bit of research. Is it around benefit take-up, around using data? I mean, there is a lot of data out there. It's not necessarily aggregated at the moment, but there is a lot of data out there. And really, the first step is for any organisation to use the data it has before looking at major changes. Use the data it has to inform an understanding of their residents, whether it's a local authority or across Wales. In Wales, they're looking at knitting all this together to a common approach, but that doesn't necessarily mean it can't be done at a local authority level. And Steffan mentioned in his introduction, there's some really, really good practice examples of this being done. I think that there's a lot of data, not just on a household circumstances and income, but there's also a lot of data held on debt. And I do feel that if this is all pushed together, you can actually start ensuring that people are applying for the benefits. Well, certainly better than we're seeing, and we're seeing different practices, but in many areas that data is not used to its full potential. And I think that that is a first preventative measure.
Interesting. Thank you very much, Zoe. I'll move on, if I may, to the cost question here. So I know, Jack, you took us through the cost in some detail. What would be, and I suppose, Steffan, this is a question for you, I suppose, what would be the cost to deliver a Welsh benefit system, and where will these funds come from?
So I think Jack's already kind of touched on really in terms of maybe some of the ongoing costs that you might see from higher take-up, and as Jack mentioned, that's not, that's a cost that you might see the benefits back as well, because this is putting money in people's pockets. They're more likely to spend it locally, might reduce their need to rely on other public services, and as we've touched on as well, it kind of might free up some kind of savings as well in terms of the administration of some of these benefits as well. There could well be also, I guess, there may well be some upfront costs from kind of some system changes that you might need to do here, and that I think would be right for the Welsh Government maybe to be looking in their direction in terms of providing the support for that. But I think there is, kind of, as I've already touched on, these are schemes that people should already be receiving support through. So the money, kind of really should be there in the system to enable this to happen. So I think it is going to be a process, maybe of conversation between local authorities and Welsh Government, or whichever other kind of administrative authority around these schemes, to kind of bottom out the best way to do that. And I think it maybe feeds into broader conversations really about kind of local authority funding, etc., which probably would be a webinar all of itself if we went down that route. But yeah, so I think there is definitely space for conversation here between local authorities and Welsh Government.
Yeah, really interesting. Zoe, Jack, anything to add on the cost?
I don't think so, other than to say, I mean, so we've got those total figures for each benefit and what the ongoing cost. If every benefit increased by the model amount, we've got a figure for kind of what that cost would be. But yeah, I think it probably does just reveal as well the complexities of the arrangement with the part devolved / not devolved system, where the Barnett consequentials that come from central government don't necessarily adjust for need in different parts of the UK. And yeah, there's bigger questions I think around how government maybe should treat sort of increased demand for benefits in different parts of the UK. But yeah, at the moment it's kind of a difficult political question, like Steffan mentioned. So
yeah.
The only comment I'd like to make, Janet, is that cost is always very difficult, isn't it? Because quite often we can do a robust estimate of increased costs of a certain benefit, how much it's going to cost to deliver the additional awards. There hasn't really been a lot of evidence-based work on the cost of not getting people benefits, not giving people enough money to live on. We know there's so much research by academics, but also CPAG, other organisations like that, that households in poverty move further away from employment. It's harder for them to get into employment. We know that the debt cycle exists. We know absolutely the awful cost to local authorities of homelessness. And somehow we talk about costs of benefit administration awards. Stopping these ongoing costs is the consequences of people not having enough to live on is a harder thing to quantify. It'd be really great to do a bit of research on that, but that is the issue we've got, is that it is actually very hard. And the reason that research hasn't been done is it's probably very difficult to do, but there needs to be a robust analysis of the cost of not doing this.
Yeah. And Zoe, I know you're one of the lead authors of our recent piece of work on the value of the unclaimed benefits across the UK, 19 billion across the UK. So, I mean, this money is there, it's allocated. So, yeah, I wonder, you don't happen to have that proportion of 19 billion that's associated with Wales off the top of your head, do you?
Not off the top of my head, Janet. In fact, when we did that bit of research, we didn't break it down. We actually had some queries from people who'd read that research or seen it in the papers or seen it on television, who asked us for those breakdowns either regionally or by country, and we actually didn't do that. What we're hoping is the methodology we set up to look at unclaimed benefits will continue year to year. So we're hoping to update it on an ongoing basis, and if anybody requires certain breakdowns or would like to see different results, either by types of household or by regions, we will include it in the analysis next year. We've already had the request, can you break this down by region? So next year, when the analysis is updated, that's what we'll be doing.
Brilliant, great. So thank you, thanks for that, Zoe. And Steffan, if I can come back to you, and I've got two quite similar questions here. I think they're about, I would just read it out. This person asks, how do we ensure that older people are not marginalised as a result of any focus on working age families, stroke poverty? And then there was a similar question there, which was, somebody says, how can we support people from particular backgrounds who suffer from inequality? So I suppose it's the particular groups of people, the segmentation part of it?
Yeah, absolutely. I think they're really valid questions and things to consider. So maybe taking older people first, I think there is definitely scope there to consider kind of a follow-on piece of work potentially, or kind of looking at kind of the support that might be eligible for people in those circumstances. In particular around kind of where those extra top-ups are available kind of on a means tested basis. You know, at the moment, a lot of those extra kind of top-ups are kind of UK levels. So something like pension credit, for example, is obviously kind of UK government-led, but there's definitely scope maybe to do a bit of an exercise to have an explore there about older people. And in terms of kind of different groups within Welsh society, I think that's absolutely fair as well. I think one of the reasons what we'd hope this would achieve is overcome some of the challenges that some groups are currently facing. So, you know, if the more complicated a process is to access, the more difficult it is for people whose English or Welsh are not their first language, and who may have poor literacy skills, the more difficult it becomes for them to navigate that system. So we'd hope of the benefits of this would be is that it would make life easier for some groups that are currently finding the current system very difficult for them because it doesn't cater for their needs. And of course, one of the things we have touched on, considered as well, is you know, as we, you know, kind of maybe primary focus being digital, you would need to retain some sort of paper schemes. Kind of Zoe mentioned about having a common paper-based kind of, you know, so that they look similar, because we know that there are going to be some people who might be digitally excluded, for example, or haven't got the skills. So that is something that we factored in as well, that you would need kind of, I guess, a backup system behind the digital stuff for those people who that system doesn't quite work for.
Very interesting. Yeah, very interesting. Thank you, Steffan. I want to move on, if I may, to another question that's come through from somebody on the webinar this morning. It says, is the key to increasing visibility of a lot of these benefits ensuring that there is a multi-agency approach across health and social care and education, for example?
Yes, I think that's certainly true. I think the simpler you make the system, the easier it is for that to happen as well, you know, because you can refer people to the one system. As I touched at the start, part of the problem at the moment is that we view these as separate from each other. So, you know, so kind of you might find an education person is quite well versed and quite familiar with kind of the school-based benefit, but are they really going to be familiar with some of the stuff around kind of older children or kind of health-related support, for example? So if you can make the system easier, but you're referring people into one system rather than each different scheme separately, that should enable that kind of multi-agency working to be made easier as well.
Yeah, thank you. Zoe, would you like to, or Jack, would you like to respond on that point too?
Yeah, I think that visibility over residents, holistic visibility, is vital to ensure people get everything they need, and I think that's the key to supporting residents. It's one of the big things that we were covering in this report, is to ensuring that any data held by one organisation allows visibility to another organisation. I completely agree that where you don't have visibility, where organisations are working in silos, you've got this problem that you also don't know how much support people are getting. You know, one organisation might be supporting them enormously and the other organisation isn't taking that into account. I think it's absolutely critical. I think it's absolutely critical, and I think the more information that's shared, we have a real problem with data, don't we? In that there is all this worry about sharing it, and people give their data for certain reasons. They want to protect it, and rightly so, and it has to be used correctly. But there's a lot of legislation around data sharing to prevent crime, prevent fraud. But we need to move to a point where data is used to actually assist people, so that you can actually reach out to people who need support rather than waiting for them to be you know, to make the application themselves. Well, we've got a system where people who often in a really crisis position are having to approach many different organisations. It's never really going to work well. People will always miss out on benefits. You need a situation where those people are identified and then supported through the application process if they need that support.
It's a really interesting on the data point, because that leads really nicely onto a question somebody has put here, or a point, I suppose, and it's picking up the point of the challenges and the barriers that you mentioned, Zoe. And this person says there is a huge barrier to data sharing, even between relevant departments within the same council. GDPR is clearly not understood or navigated. Officers don't have the time or capacity to develop their understanding and shift how they work. In this context, what is the most expedient way to reassure council officers that data sharing really is okay? Question mark, Welsh Government guidance, question mark. So we've lost Jack, but Steffan, Zoe, maybe to you, Steffan, that point about the guidance and helping make that change.
Absolutely, I think that's something that Zoe teased out in the report as well. I think about kind of the role of guidance. I always remember when we first started doing this around the pupil development grant access to the school uniform support, there was one local authority in Wales at the time that required receipts from every single item bought under that grant, and it was the only local authority doing so. And when we were trying to work out why that was the case, it was because the guidance from the Welsh Government wasn't particularly clear. Therefore, the local authority had adopted a very risk-averse approach and had gone down a route that I think, well, 21 of the other local authorities had decided that wasn't particularly efficient use of their resources or good for take-up. So having just a simple thing of having more clear guidance for that local authority would have enabled them to have adopted the same approach as the others. And I think that's absolutely true around some of the data sharing point as well. Reassuring people who, as the person asking the question said, are not experts on data law, reassuring them you can do this, you don't need to worry, we will not be taking action against you if you take these sort of measures.
Very good, very good. Zoe, anything to add on that?
And not really, and I completely get where that questioner was coming from, and we've seen across local authorities massively different interpretations. I think it often helps local authorities to find out what others are doing. If the person who asked that question has got any particular query, do get in contact. We have a data governance expert at Policy and Practice who's been working with a lot of local authorities and understands the position across the country and can actually help work with your local authority around that guidance. I know there is a lot of expertise within local authorities, but it does come down to individual interpretation, and sometimes people just need to know that other councils or other areas are interpreting things differently. Wales is in a very useful position because you've got a government that wants to make these changes so that they can start offering guidance. A lot of this is around risk, exactly as Steffan was saying, and we've got to remember that Revs and Ben departments and local authorities are coming from a position of administering housing benefit and council tax benefit in the part where they were heavily audited. The risk level was very, very low. Now that council tax reduction is localised, there may be room for guidance on the level of risk that is acceptable, rather than maintaining the same level as historically. I think that's where guidance comes in. It's more about this is the acceptable pattern, and this is within local authorities, we agree between us that this is where we want to go. It doesn't mean that I don't feel there should be more gateways to sharing data. I also believe there's a legislative issue here. And I think that certainly on the CTR regulations, the Welsh Government, because they're the ones who are issuing these, can say that the intent to claim CTR amongst in the UC data share is actually a claim. They can do that within those regulations. What I'm thinking is from central government, it would be very useful to have different gateways to data sharing. Beyond that, you have to look at how you make a sensible approach to using the gateways that already exist.
Brilliant, thank you, Zoe, and good shout out there to our data governance experts. As you say, we're very happy to help local authorities with those issues. I'm very conscious of time, but I just want to, a couple of points. Somebody helpfully has said on your point, Zoe, about the cost of not taking up benefits. Somebody says the Equality Trust reported in 2014, so nearly 10 years old, that the UK spent £39 billion mopping up the problems associated with people having insufficient income, brackets health and crime, etc., compared to similar OECD countries with more equal economic income distribution. Sorry. So yeah, a 10-year-old report, but as you say, more is needed. Now, let me just finally move on to our last question, if I may. for yourselves, Steffan. How do you predict the recommendations around identification and application will ensure that sufficient support is maintained for people in highly precarious situations, for example, people remaining in supported accommodation while entering work?
Yeah, so I think, I guess touching on the themes we've discussed really about making it as simple as possible for people in difficult circumstances, takes some of the stress away. If you've got a complicated process with multiple forms and you're in a really stressful place, that is not going to encourage you to apply for that support you need. So making that simpler should hopefully enable people to feel in a better position to do that. But also that's where I guess having, you're always going to need some kind of, maybe that's part of where some of the discretionary support schemes, so something like the discretionary assistance fund is going to, that's why those schemes, there's a role for them perhaps, is that people who are in kind of particularly difficult circumstances, but you've got another kind of form of support to mop up kind of a little bit in terms of what your rights-based schemes might not be getting to. And what we really want to see is that the rights-based schemes are effective as possible. That reduces the pressure then on the discretionary sums from just kind of papering over the cracks in the social security system, which is what's happening at the moment, to actually going back to offer support for people in kind of really difficult circumstances as a temporary form of support, whilst we're able to get them back on these kind of rights-based schemes to provide the support that they need.
Okay, great stuff. Thank you. I'm going to sneak one last question in because I do see that most people have managed to stay on. So this very last question, I promise. How do we ensure unintended consequences don't stem from including a declaration of intent to apply for Welsh benefits on UC applications? So no kind of talk about what those unintended consequences might be. But Zoe, is that anything that came up during the research or anything that came across your radar doing the work?
No, I think I need to know more about what the unintended consequences are. I think all these things need looking into. They need the practical application of the recommendations needs to be looked into. I'm not sure that I've really got an idea of what unintended consequences you're talking about. If you're talking about that people may wish to apply for one Welsh benefit and not lots of others, that would have to be undertaken through the benefit application process. And could be done early on in an application process if people really didn't want to apply for certain benefits but did want to apply for others. Other unintended consequences, if you can drop me a note, I'll discuss with Steffan and we'll try and get a response to you. I'm sorry, I'm not seeing what the problem is here, and I do apologise for that. It's probably something very obvious I'm just not seeing, so it'd be great if you could just drop me an email and I'll get back to you.
Brilliant, great stuff. Thank you, thank you. I think we can leave the Q&A there. I think there's been quite a broad range for us to get to, so that's been really useful and very interesting. I hope everybody else has found it the same too. What I would now like to do, just very briefly and quickly, but nevertheless hugely heartfelt, to say a big thank you to our speakers on today's webinar. That's Dr. Steffan Evans from the Bevan Foundation, Zoe Charlesworth and Jack Rowlands from Policy and Practice. There are some contact details there up on the screen, and if you do want to get hold of Steffan, by all means come through Policy and Practice. But Steffan, I don't know if you just want to read out what is it an easy email address that you have?
Yeah, so maybe the info@bevanfoundation.org probably is the easiest one there for people as well if they haven't got our contact details already.
That's an easy one to remember. Brilliant. So thank you very much everybody for your time today, and I hope to see you on another Policy and Practice webinar again very soon. Take care, enjoy the rest of your day. Bye bye. Thank you.